Dr. McAllister, thanks for joining us on Florida Today this morning.
It's my pleasure to be here. Thanks for having me.
Now, we hear about migraine headaches all the time. I have a migraine, somebody has a migraine, and I have a suspicion that people don't necessarily know what migraine headaches really are. So what is a migraine headache?
So I think you're absolutely right. People have some odd ideas of what a migraine is. Most of us in this country suffer from the occasional headache, a mild tension headache, but a migraine is different. Migraine is a genetically inherited brain disorder that's characterized not just by a moderate or often severe headache, but nausea, sometimes vomiting, light and sound sensitivity, mental slowing, a fuzzy head, dizziness. So it's really a whole body shutdown condition that's manifested by neurochemicals in the brain. And when it happens, it often leads to what we call functional disability. That is, the patient misses something. So my kids will miss school. My adult patients often will call in sick to work. It's hard to take care of kids. It's really hard to have quality of life when you have migraine.
And then we have chronic migraines. What is the difference between that?
Right, so now we're talking a subset, really the worst of the worst. So it's estimated that about 36 million Americans have migraine, and women 3 times more than men. But it's also estimated about 3.2 million Americans suffer from chronic migraine, which is defined as 15 or more headache days per month. So half a month with these headaches lasting more than 4 hours a day and associated with the migraine symptoms like the light and sound sensitivity and the nausea on at least half of those days. These people have significant disability. These are the folks who can lose their job because they keep calling in sick to work. They have increased risks of depression and anxiety. They drive up health care costs because they're going to emergency rooms or trying to seek out care. So this is a really disabling condition for which we now have a treatment, and we're trying to get the word out.
And the treatment we're talking about here is Botox, which obviously this is not what we're used to hearing Botox being used for, but now Botox is, in fact, a treatment for migraines and chronic migraines.
Yeah, interesting. I'm not a cosmetic doctor. I'm a neurologist and headache specialist, and yet Botox has a number of non-cosmetic uses that neurologists use it for, including strokes and some muscle spasm conditions. But interestingly, we found almost by accident some years ago that those who receive Botox injections in their head, often for cosmetic reasons, would say, gee, I look terrific, that's great, but I also used to have these bad headaches and I just don't have them anymore. That led to about a decade's worth of research, and I was one of the investigators on a large study that culminated in the FDA approving Botox for chronic migraine, 15 or more headache days per month, back in October of 2010. And I tell you, as a headache specialist, I was thrilled because we now have something else in our toolkit to offer patients who have this disabling condition.
And do we really know what a migraine is, or do we really know exactly what causes migraines, or is it still one of those things that there's a lot of thoughts on?
Well, I think both. I think that we are learning more and more, but we still don't have the answer. We know genetics plays a role. We know there are certain bad transmitters in the brain that get activated. We also know that migraine is the disorder of the brain nerves themselves rather than the blood vessels. The old thinking was it was a blood vessel condition. This is a brain disorder, and we're starting to get an idea of the anatomy and the physiology, and that's going to help us design even better treatments going forward.
I was going to say some of the synapses just aren't firing the way they're supposed to fire, basically.
Right. There seems to be a turn-on of the big pain center deep in the brain in an area called the brain stem. And when that happens, the patient has about a half hour or so to put out that fire. And if you take a specific migraine medication, you often can nip it in the bud. But if not, this thing takes off, and really the entire brain lights up if you do some fancy scanning. And that has to get shut down over days, which is why migraine can linger for a day or 2 or 3. And then even afterward, the patient feels like, a wet dish rag, and they're hardly able to function even after the pain is gone.
96.5 The Jet, Wjtk. The focus is on migraine headaches and the use of Botox now in the treatment of migraine headaches. Dr. Peter J. McAllister is joining us. He's the Director of Clinical Research at the Headache Center at Associated Neurologists of Southern Connecticut. He's also a clinical assistant professor of neurology at Yale University School of Medicine. Your business card must be about the size of a 3x5 index card.
And it's getting bigger, right?
A lot of stuff there. So Botox is a prescription medicine, so you do need to go to a specialist to make sure that it is proper for treatment for your migraines.
Absolutely. And it's interesting that of this 3.2 million people in this country who are suffering from chronic migraine, it's estimated that 80% don't even know they have it. So it's very important that folks who are having frequent, repetitive, day in, day out, week in, week out migraines, seek out a neurologist or headache specialist because, as you said, this is administered by a doctor. It's little injections with a small needle around the forehead, the temples, the back of the head, the neck and shoulders, and it can give patients up to 12 weeks of a reduction in the number of headache days and headache hours, and in many ways help to give them their life back.
Is this one of the treatment options that definitely should be on the table? And again, a neurologist or a headache specialist would know exactly what direction to take you in.
That's right. And, just getting in the door, getting to the headache doctor, we work on other things, too, in addition to giving the Botox. We work on, vitamins and diet and exercise and sleep and depression, and all of this factors into making a patient a 1 or 2 day a month migraine sufferer versus an 18 or 22 day a month migraine sufferer. And as you can imagine, one is bad, the other one's horrible.
Is there a website where they can get information on Botox and the treatment of migraines?
Sure. I think the best website I can give your listeners out in the Jacksonville area is BotoxChronicMigraine.com. So if they go to BotoxChronicMigraine.com, there's a wealth of information on what chronic migraine is, how it's diagnosed, what Botox is, and there's even a place where they can put in their zip code and they can find specialists in their area to help them with their condition.
And it is administered as you would expect Botox is administered. You mentioned it's a small needle, and it is an injection, so it's not a pill. It's not any kind of a fluid that you have to take internally.
Right, and you may be alluding to the utility of that. I mean, it's being not a pill, it stays local, so we're not going to have stomach upset or kidney failure or liver trouble, etc. So in a way, it's a very pure treatment for this condition.
Is it a very time-consuming treatment?
It takes me about 2 or 3 minutes to do the whole injection cycle.
Okay, that answer would be a no then, as far as the treatment. Obviously, you do need to go through a battery of examinations first to make sure it's proper.
Exactly. Botox isn't for everybody, and not everybody who has frequent headache has chronic migraine. There are other conditions as well, which again goes back to it's important to seek out a neurologist or headache specialist and get the diagnosis.
Because, again, migraine is one of those, it's like the flu. People just say, I have a migraine without even knowing whether it is a migraine or not.
Exactly. There's a lot of misinformation out there, but we're hoping to change it, and shows like yours are certainly helping down in Florida.
Well, we're happy to help. Now, what is the website again?
It's called BotoxChronicMigraine.com.
And Botox, B-O-T-O-X, as you would expect, BotoxChronicMigraine.com. And we also want to thank the folks at Allergen Incorporated, that's Allergen Incorporated, for sponsoring this and for getting the information out, because it's always nice to know that there is another avenue you can take, especially if it's something that's already been proven safe and been used for really dozens of years.
That's right. Not a lot of people know, but it's been out since the late 1980s.
Well, I appreciate you taking the time to join us here, Dr. Peter J. McAllister, and we look forward to talking with you again. Thank you much.
It's been a pleasure, Bill. Thank you. It's been a pleasure, Bill.